Hi, I'm Dr. Ness, and I want to thank you for taking a few moments to learn a little bit more about the process of plastic surgery. We love transformation stories, and we understand that it is our pleasure and our privilege to participate in this part of your journey with you as you're considering plastic surgery to help with some part of a life transformation. Plastic surgery is a unique specialty because we deal with not just repairing or fixing something that's broken, but taking something that's already relatively normal and trying to make it better. Different from appendix or gallbladder surgery, where nobody will probably ever see the result of the surgery that was done inside, plastic surgery is very visible, and so we have a lot more attention to detail with those things that will make a final difference in the appearance for each patient. Each person has a different set of goals, and plastic surgery is both art, science, and a little bit of psychology to try to understand how we can help you meet those goals with plastic surgery as part of your treatment plan. We spend approximately 45 minutes to an hour discussing your goals, carefully listening to your concerns so we can determine the best course of action to meet your expectations. We know that not everybody is a good candidate for plastic surgery, and plastic surgery is not for everybody. However, if this is part of a plan for you to accomplish something that's been bothering you for a long time, then I think plastic surgery can be a very rewarding experience for the majority of patients. Having said that, plastic surgery is a little bit of an interruption. Even the smallest procedure can be a little bit of a hassle and can result in some inconvenience, especially during the recovery period immediately following surgery. Bruising is probably the most common thing that we consider because even a little bit of bruising can go a long ways in terms of noticeability following a procedure. Bruising typically will resolve in about a week, sometimes two, depending on how fast or how slow you heal. Swelling is a little bit more slow in terms of its resolution, and it can take up to several months before we feel that you're back to normal. Scars continue to mature over time, and those can sometimes take up to a year before they are soft and as normal as they will eventually be. Pain is always a consideration following every surgical procedure, and our goal is not to minimize each patient's pain experience, and will provide a variety of different resources to help manage pain with a combination sometimes of narcotic and sometimes of anti-inflammatories, or even regular Tylenol is very effective for a lot of patients. Each patient needs to consider the consequence of scars. 100% of the time, if an incision is made, there will be a scar. The scar is permanent. My goal is to try to minimize the appearance of the scar by careful planning and placement of the incision and final scar in areas that will be the least conspicuous. We do a careful planning before surgery with the location of the scar. The technique that we use as we're removing the extra skin is also an important consideration, and how we close the incision with different layers and breaking the tissue up into smaller segments so that the tension is distributed more evenly. We also like to use a type of skin tape called Steri-Strip or an adhesive called Dermabond. These products will help control and prevent wound separation and improve the healing process. Typically, they'll be in place for about 3 weeks, and at which time when they come off, we'll often recommend either fingertip massage with a moisturizing antibiotic ointment or Vaseline, or a scar prevention tape that you'll wear for approximately 8 weeks. We find that with this combination, we can reduce scar tissue by about 50% most of the time. The wounds will continue to mature for up to a year before they will be at their full strength and be as minimized as possible. If we find that your body is creating too much scar tissue and is overhealing, creating what some people call hypertrophic and incorrectly sometimes called keloid scarring, we'll recommend a course of either topical steroid cream or steroid injections into the scar, which can help further modify or suppress the scar tissue formation. One other consequence that we'd like to consider is asymmetry. No two sides of the face or two sides of the body are identical. They're similar, and we know that there are pre-existing asymmetries in everybody. We'll try to identify those with you during the consultation process and often use the photographs to also show how the sides are similar and how they're different. And typically, some of those asymmetries will persist after surgery because they're bone or structurally related and cannot really be altered with surgery. We'll discuss that as part of your specific treatment plan during your consultation. Each patient has a pretty detailed informed consent process where we talk about the risks and benefits of surgery. The risks of surgery are the same for almost every procedure, and the most common risks are bleeding and infection. Each patient also has the possibility of developing bleeding following surgery. The primary role of the surgeon is to control bleeding in the treatment area. We use cautery, sutures, and sometimes clips to control every little blood vessel during the time of surgery. If you leave the surgical center and a blood vessel pops open that was previously collapsed or closed, that can result in a blood collection called a hematoma. This often requires emergency attention, and we would recommend or direct you to a nearby hospital after hours if needed to take care of that problem. Our after hours hospital is Maple Grove Hospital, located conveniently on 94 and 494. If you need to go to the operating room, these types of procedures are often covered by your insurance, but you should check with your individual carrier to find out what your coverage is. We think of these things as being like being in a car accident. Things happen and you have insurance to help take care of that situation as it arises, but those would be potential additional expenses to consider. Bleeding as a complication is quite uncommon, and significantly less than 1% of our patients have had this experience, but at the end of the day, it's still surgery and it is an important consideration for your planning. I don't typically charge a revisional or extra professional fees for these types of things, as they're included in your initial payments for surgery. These are often a hassle and an inconvenience, but it's something that is a part of the surgical process, and we want patients to be aware of this before they proceed with any type of elective surgery. Infection after elective surgery is quite uncommon because we treat everybody with a preventative antibiotic by vein before surgery. We often use a broad-spectrum antibiotic for several days after surgery until the wounds have been suitably sealed to prevent contamination. Sometimes we'll use a topical antibiotic ointment to also prevent superficial or skin contamination. My mom was right about a lot of things, but she was wrong when she said, just let it get some air on it and form a scab. We don't like scabs and we don't like crusts. We do believe that moist healing is best, so we believe in wound suppression and protection during the healing, and your postoperative instructions will carefully detail the instructions related to your specific procedure. Each surgical procedure also involves some medical and anesthesia considerations and possible risks. Every patient will have a complete history and physical examination done by their primary doctor prior to surgery to make sure that the surgery can be done in a safe manner. One of the most preventable complications is blood clots to the legs or the lungs. We treat these preventatively by using compression devices during surgery that will have the effect of kind of massaging your legs and simulating walking while you're asleep. This type of surgery is called ambulatory surgery because you should be able to ambulate or walk in and ambulate and walk out following surgery. Once you get home from surgery, we don't want patients to lay around in bed for several days, as was the previous case a few decades ago where people would be on bed rest for 3 or 4 days. We want people up and moving and walking, drinking plenty of fluid with light activity. Following surgery, as soon as you're able, we want you to walk 10, 15, then 20 minutes several times a day to encourage blood circulation. This will also have the benefit of reducing some of the unnecessary bruising and swelling that occur as a consequence of surgery. Every patient has the possibility of experiencing some numbness as a consequence of surgery. Numbness is often caused by a nerve that's been either bruised or crushed or damaged as a consequence of surgery. Typically, numbness will slowly resolve over several weeks and months, and complete resolution can sometimes take up to about a year. Patients will know that the nerves are returning to function with a sensation of pins and needles, sometimes a sharp stabbing sensation, or even a crawling sensation under the skin as those nerves regain their complete function. Sometimes, and infrequently, numbness can persist and be permanent, although this is often less noticeable over time as your body adjusts to the new sensation. Even with the best planning, the optimal surgical techniques, and optimal healing, patients can still experience disappointment in regards to their surgical outcomes. I want each patient to know that we have a plan for treating disappointment and unexpected consequences from surgery. We try to understand each patient's goals prior to surgery and make sure that we have a clear understanding of what the expectation is for improvement. All of these surgical procedures take quite a bit of consideration and additional thought and planning, and a lot of patients have a high expectation for improvement following surgery. I want to assure you that we'll work with you to provide the best result that we can provide with all of the variables that we've discussed. If we find that you need some type of touch-up or enhancement surgery following your original surgery, we do not charge for those procedures within the first year following surgery, but you may have additional charges related to the anesthesia or operating room charges, and I think of it as being basically like renting the operating room for 15 minutes up to an hour. These charges will usually range from $500 to $1,500 for that session, depending on how long the procedure is. We try to minimize these possibilities by doing the best surgery the first time for every patient, but ultimately your body may decide to do something differently and heal differently than we anticipated. I want to thank you for taking this time to learn a little bit more about plastic surgery, about the goals, expectations, risks, and benefits to help you make an informed decision. Thanks.